How can you prevent erectile dysfunction? I'm Dr. Rena Malik, urologist and pelvic surgeon, and in today's video, I'm going to cover the 5 things you can do today to help prevent erectile dysfunction in the future. So make sure you listen to all 5 and help future you. First and foremost, you want to treat your underlying health issues. So if you have high blood pressure, get that under control. If you have diabetes, get that under control. If you have high cholesterol, get that under control. Very simply, fix those issues first, because without fixing those issues, you will not be able to reverse your erectile dysfunction, and it's just going to get progressively worse. Next up, exercise. So there's been a number of studies that have looked at exercise. In fact, there's been 11 randomized controlled trials comparing people who either get no instruction to people who are instructed on doing some sort of aerobic exercise intervention or resistant exercise intervention. And they compare those. And that allows us to see head to head, when you take people who are very similar, if there's really a benefit. And these studies ranged in duration from anywhere from 2 months to 2 years. And they include different types of supervised aerobic exercises. They may have provided resources and counseling. And typically they were doing about 30 to 60 minutes of aerobic exercise, somewhere between 3 to 5 times per week. They typically did things like walking 5 times a week, at least with a VO2 max of 55%, which means that you should be able to, which is sort of like zone 2 cardio, which means that you should be able to take a walk and have a conversation with somebody, but they would know that you're exercising. It's not such a leisurely stroll that somebody can't tell. The other exercises they tried were things like cycling, treadmill use, but they made them do it, like I said, for 3 to 5 times a week. And generally, they called it moderate intensity. So what they found ultimately was that aerobic exercise resulted in statistically significant improvements in erectile function compared to people who didn't do any aerobic exercise. And it was generally greater in the men who had more severe ED. So if they had more severe erectile dysfunction, you were going to see a much greater improvement in erectile function versus someone who had mild ED. And that makes sense, because if you have mild ED, you have less room to improve. Whereas when you have severe ED, you have a lot more room to improve. And so they did see a significant improvement in all 3 groups: mild, moderate, severe ED. Everyone saw an improvement. And exercise works because it improves blood vessel function, and it allows those blood vessels to improve their nitric oxide production. When you have healthier blood vessels, they release more nitric oxide, which is the ignition for erections. And if you incorporate resistance training, you're also going to see improvements in your testosterone. Now, I've talked about exercise and testosterone in a full video on YouTube. Make sure you check that one out if you want to learn more about it, because I go over what exactly types of exercise have been studied and what you can expect in terms of improvement. Now, in addition to those things, exercise tends to reduce oxidative stress and inflammation, which are both contributors to worsening erections. Next thing you can do, which is completely free, is sleep. Now, I think sleep is the most underutilized treatment in medicine for a lot of different conditions, but even for erectile dysfunction. Now, in small studies, they've looked at sleep and they've shown that improvements, particularly in sleep quality, meaning that you're having uninterrupted sleep, you're getting good amounts of deep sleep or REM sleep, and you're sleeping for sufficient periods of time, usually 7 hours or more, means that you're going to have better erections. Now, as I mentioned, these studies are pretty small and observational, but ultimately sleep has really good evidence in terms of improving testosterone quite significantly. And not only does it improve testosterone and sexual function, it's also going to impact your ability to perform the next day, improve your mental clarity, your sharpness, and your overall mood. So there's so many reasons to work on sleep. And I've had a couple videos on sleep on my YouTube channel, so check those out. Now, what about food? Everybody wants to know, what should I be eating? So a 2020 study in JAMA, which is a very reputable medical journal, looked at diet quality and dietary patterns associated with erectile dysfunction. Now, this is again correlation, but they looked at men from 1998 to 2014. So it's a long period of time, and they looked at what's called food frequency questionnaires. The men were between the ages of 40 and 75, and they had to fill out these food intake questionnaires. And so they had 21,000 men who were on average 62 years of age, and they were followed for about 10 years to see what they were eating and how that correlated with erectile function. And they found that men who had the highest score related to the Mediterranean diet, meaning they were following that, they had the lowest relative risk of incident erectile dysfunction, meaning they were the least likely to develop erectile dysfunction compared to those who had a lower score, meaning had poor dietary quality based on this questionnaire, this Mediterranean diet score. Now, this was true for men who are younger than 60, 60 to 70, and even over 70 years. So it doesn't matter how old you are, when you start eating a healthy diet, if you can commit, you will see improvements. It was more impressive if you started younger. So if you were younger than 60, it was a 22% lower risk of developing ED. If you were between 60 and 70, it went to 18%. And if you were over 70, it went to 7%. Now, the best studied diet in terms of healthy diet is the Mediterranean diet. So what is the Mediterranean diet? Well, it emphasizes things like plant-based foods, fruits, vegetables, whole grains, nuts, and legumes. It uses olive oil as a primary fat source and nuts, as I mentioned earlier, and consuming fish and poultry in moderate amounts and limiting red meats. And they tend to use more herbs and spices rather than salt. Now, I think the key is to really avoid processed foods and focus on whole natural ingredients. Now, what about specific types of foods? Like you'll see all these articles online and like, these are the 5 foods you want to eat. And actually there's some data behind certain types of foods. So one is called flavonoid-rich foods. And these are a type of what we call polyphenol. And they're abundant in a variety of plant-based foods. They have lots of antioxidants, and they tend to reduce inflammation and lower the risk of a variety of diseases. And these can include things like apples, citrus fruits, grapes, onions, tea, dark chocolate, and kale. And so in one study looking at the same group of men that they did in that prior study about the Mediterranean diet, it's called the Health Professionals Follow-Up Data, looked at 25,000 men. And they found that those who had a higher intake of these flavonoid-rich foods had a significantly lower incidence of erectile dysfunction. This study was not as remarkable in terms of outcomes as the Mediterranean diet. And so what they found was that it reduced your risk of developing ED by about 9% if you had a higher intake of these flavonoid-rich foods. What about other sort of food items or things that can help? One is omega-3 fatty acids, and these are typically from fish, and they can help increase nitric oxide availability. If you don't eat fish, you can try taking omega-3 supplements. Another food that often comes up is watermelon. And the reason watermelon comes up is because it is a rich source of something called citrulline. And citrulline is an amino acid or a protein building block that's metabolized in our bodies to arginine. And arginine is a precursor for nitric oxide. Again, remember, nitric oxide is the ignition for erections. So a small study found that if you drank somewhere between 3 to 6 cups of watermelon juice per day for 3 weeks, it resulted in an increase in arginine levels in the blood. However, they didn't specifically look at erectile dysfunction. So if you like watermelon, by all means, go ahead and have it. But if you don't force yourself to. So bottom line, what can you do to prevent or reverse ED? So 1, increase your physical activity. Try to have 30 minutes a day or 150 minutes a week of moderate intensity aerobic activity. Next, if you are overweight, losing weight has been shown to improve erectile function. So try to lose 5 to 10% of your body weight if you are overweight. Next, improve your diet. What you want to aim to is increase your consumption of fruit and vegetables, whole grains, and legumes. Limit your red meat and processed foods, and reduce your saturated fat to at least 10% or less of your entire calories. Increase your intake of monounsaturated, polyunsaturated fatty acids, and stop drinking sugary drinks. So try to drink water or diet drinks if you have to have something that's a little sweet, but try to avoid things that have added sugar. Avoid excessive alcohol consumption. Try to drink less than 7 drinks a week, and ideally none if you want to follow the newer data that shows that there's really no safe amount of alcohol consumption based on cancer risk. Lastly, quit smoking and don't do any recreational drugs. If you're going to do recreational drugs, be sure not to do them chronically or in excess. Thank you guys so much for watching. If you enjoyed this content, this is from a clip of my podcast, and you want to get more content like this, make sure you subscribe to my podcast on Apple Podcasts, Spotify, or wherever you consume podcast content, and leave me a rating or review. And as always, remember to take care of yourself because you're worth it.